Okay, so this is just the final presentation of kind of a review of this summer. And at the end is like the recommendations that I was asked to give for the end of the program. So this was the overview. Um, what I learned a lot about the background was it helps a lot to raise awareness to diseases affecting non-Western countries and developing cures. In this case, we were focused on vaccines to help battle major illnesses that are not seen as major because they are in these tropical areas that don't have as much funding or as much access to resources. The overall mission is to give access to better healthcare solutions and train a new generation in honor of the founder, Jacinto Convit. So all of this helps raise this awareness while also creating healthcare solutions for people who live in these areas that are kind of missed by like Western medicine. So this is kind of an overview of everything that happened while I was interning here this summer. So in the beginning, we reviewed initial documents on leishmaniasis, the illness itself, and then on vaccine development. Then I did a deep dive into current and developing treatments. I went forward to research the World Health Organization's pre-qualification process and reviewed the World Health Organization's dossier, along with a breakdown with each section of it. And at the end, I wrote an article further discussing leishmaniasis and its treatments that are currently available or in development. A couple of the conclusions that I came to by the end of the program was necessity. There is a high level for necessity for more research to be carried out in non-Western countries that do not have high resources but have high need of medical help. A lot of the times when I was researching things for either for the article at the end or in the beginning, looking for treatments, there aren't a lot of research articles that are yet published or that have a lot of resources to actually have a lot of the answers of what people in these countries might need in terms of medicine or what treatments might even be the best for them. Another conclusion was accessibility. Being able to access medical treatments should be universal. So there has to be cheaper, equally effective and safe treatments that have to be developed and approved in order to close this gap of medical accessibility. In these countries, usually they don't have the money to either get these treatments, and they also don't have the time to get these treatments because they have to be able to keep working. So cheaper, effective treatments that can also allow them to continue work through whatever it is that they're going through would open medical accessibility, which would close this gap. Another thing that I learned, that I concluded, and is dedication. So this organization is founded on the dedication of one man that has since then grown to encompass so many different aspects of medicine. And it is that legacy that continues to inspire new generations. And it's something that I really kind of believed through the entire time that I was interning here. And then at the end, I was told to add a recommendation. So my only one would be to add more information to the dossier that I was helping review. There are things that have to still be filled in, and there are some areas that could be clear on what section specifically needs, but a lot of this had to do with manufacturers that weren't still set. So it could be easily like completed after that.